Welcome to Bastyr Sports Medicine Club's wrist taping video. First, apply 2 anchors. As you can see, we have an anchor on the proximal forearm and the distal metacarpals being placed. A couple anchors may be needed. Apply a support pattern. This includes an X pattern or a triple line pattern over the joint space. In this demonstration, you'll see that the athlete is getting an X pattern placed. The trick is that the center portion of the X be right over the joint space. This helps with either radial or ulnar deviation, as well as excessive wrist extension when applied on the flexor surface of the wrist. It can be helpful to cut out a couple pieces ahead of time, the desired length. Here you can see that about an inch width tape is being used to make the X pattern. The anchors come in handy as a place for the tape to attach. It is suggested to overlap some of the X pattern slightly so that way you get multiple angles of essentially restricted movement. Keeping the wrist in a slight flexion during this taping is important. Approximately 2 or 3 layers sometimes is needed, where you can apply the X pattern alternating with the triple line pattern. Here you can see the tape being applied near the thumb and being wrapped around to the opposite side. Sometimes maneuvers like this can help support the thumb. Be cautious though about the tape digging into the thumb. At this point, the taping may not be very stable. It's not until the final tape cover that this X or triple pattern really takes effect. Applying the final tape cover, be cautious about applying it too tight and too light. Here you can see just simple tape wrapping going around, holding the X or triple line pattern in place. This helps with aesthetics as well as covering any pre-wrap or any areas that aren't supported. Have the athlete test the wrist to see if it's providing the support that's needed. You can see that the athlete is maintaining that slight wrist flexion while the tape is being applied. And that's it.